Hi everyone, I'm Maimah Karmo, your host for Breathe TV, and you're watching season 2. When you hear the words breast cancer, it's terrifying. You get scared, and there's so much fear around the journey, the diagnosis, fear of recurrence, and other things like that. We'll be talking to an amazing woman today, Dr. Pat Washington, who is an expert, a clinical nurse educator, and researcher who studied fear and its impact on cancer and cancer patients. Dr. Pat is being with us today. So tell me a bit about your journey and your background being an oncology nurse and an oncology patient.
Well, I've been an oncology nurse for about 37 years. I started out my career at MD Anderson Cancer Center in Houston. We focused on teaching patients how to communicate with their healthcare provider, and it was mainly centered around pain. I have been in industry now for about 21 years. All of my experience has been in oncology.
Well, your work sounds amazing, and you look like you're 30, so I don't know how you've been doing this for 20 years. That's a lot of work to be doing in 20 years, but I'm so proud of what you've done, and I look forward to hearing more about it and sharing with our audience as well. You talked about pain management, which for me, I find intriguing, because you don't often get asked about pain management as an early stage patient. Does your work support patients who are early stage patients and those who are metastatic breast cancer patients?
Yes, it was both. It was both patients, both metastatic and then early stage. We were looking at African Americans in particular. There was actually some videos made as well as an educational booklet. And these booklets were culturally sensitive, and they were written like at a fourth grade reading level, because a lot of the patients were socioeconomically disadvantaged in terms of their educational level, their income, status, and things like that. And they lived primarily in underserved areas. And so we looked at the outcomes, and they even looked at quality of life, and these patients seemed to do better who were educated using these culturally sensitive methods.
Health literacy is so important. I mean, even for myself, being highly educated, once I heard the 4 words, "you have breast cancer," my mind went blank. I couldn't process anything. I literally couldn't find my driver's license. I lost my keys. I couldn't think straight. I was a zombie for a couple of days. My girlfriend came from California to help me pick my doctors because I couldn't function right. There's all these things you have to become an expert in overnight, and anybody of any walk of life is going to be overwhelmed. So health literacy is really important, and I think this project, it sounds really amazing. I'm glad you did it, because what you do is you're helping people who are in the fight for their life and who are terrified about getting through cancer and the fear of recurrence, get through that with somebody who's saying, "I got you the whole time, and I'm with you, and I get it." When you're at your most vulnerable, right? So thanks for all you do for people across the country. I applaud you for that, and God bless you for all that you do.
Thank you.
You're welcome. So, thinking about the patient journey, a lot of people, most patients, experience fear of recurrence. And so when you're talking to patients, how are some ways that you can help them deal with fear of recurrence in the ways that fear impacts their lives?
So first of all, I think acknowledging that fear can be absolutely overwhelming for patients. And, it can be very different from their initial diagnosis. And when you think about recurrence, it often implies a worse prognosis and an increased mortality. And this fear can, like you said, can be very debilitating, or it may be a catalyst to action and self-advocacy. So you have 2 ends of the spectrum, but more often than not, it's typically this fear and anxiety that renders the patient unable to just move forward. People cope with recurrence or the threat of recurrence or a potential scare. They look at that and they respond in a bevy of ways. They can be in denial, they may withdraw, they may seek prayer, they may seek alternative or complementary therapies. You have a group of patients that may seek information, but the only problem with that is they need to have reliable information. What I think people need to keep in mind is that, these patients, just cope differently. The first thing is to identify any triggers or certain things that may intensify anxiety or fear. And when you think about these triggers, they can be both external and internal triggers. And so if you think about external triggers. That would include things like the anniversary of their diagnosis or their surgery. If they have to go into a follow-up appointment, if they have to go for a scan or testing, it can cause anxiety that can be overwhelming for the patient. And actually, there's a name for that. We call it scan anxiety. Scanxiety is what it really is. It can evoke all types of fears and concerns, not only with the patient, but also their family members. And then other external triggers would be things like they're watching TV and there's a celebrity that's been diagnosed with cancer. This can evoke all types of feelings of angst and, evoke difficult memories for patients. Patients may have a physical symptom like pain or fatigue. And, the survivors may be concerned that these conditions and associated symptoms are linked to the previous cancer or cancer spread. It was quite often I would see patients who would have a headache, just a simple headache. We live in Houston, and so, we have a lot of allergy issues here. And, when in fact the headache was most likely related to their allergies, but they automatically thought they had brain meds. So that's a very difficult position to be in. The first thing, like I said, is identifying triggers. The second thing is just to have a plan for dealing or coping with the fear of recurrence. If you're nervous about an upcoming appointment, have a plan in place to help them to get through the week leading up to the appointment as well as the day of the appointment. For example, you can plan activities that can help to distract you. And it's really important that you make a list of things that can help you to reduce your anxiety. Things that you have resorted to in the past to help with that. So that's very helpful.
I feel like, that plan needs to also continue throughout your life because the fear never really goes away. No. People always will say, like, you're so fearless, you're so bold. I'm like, I'm scared every day. But I channel my fear, to your point. I don't let it debilitate me. I mean, it did for a while. A friend of mine, to your point, if a friend gets re-diagnosed and is metastatic or is dying or does die, that fear comes back and is so intense. And I feel like for me, my role is to be really authentic. And there are days when I'm in bed, curled up in a fetal position, terrified. And I have anxiety attacks or panic attacks just because, once you have cancer, you're never not a cancer patient. So what I choose to do with my life is to live boldly, to take chances, to do things that make me uncomfortable, to help people, to serve others, and to write books and do all these things. I made a list of all things I wanted to do and I did them, but I still have the fear sometimes, but I'm still living anyway. So for those who are watching, we're not saying that if you're afraid that it's a bad thing, we're saying that there are ways to cope with that. Some things I do, I have a really intense spiritual practice. Meditate in the morning to calm my mind. I do yoga in the morning. I pray a lot, I journal. And, living with cancer and the fear of recurrence is a lifestyle, really. It's really not about just getting diagnosed and dealing with it then. It's kind of putting in place a plan to manage yourself mentally, physically, and spiritually. And having a support system of friends you can call and say, oh my God, I'm having a little freak out, someone got diagnosed, I talked to a patient. It's about having the plan when you're diagnosed and having a plan afterwards in terms of knowing this is part of your life and learning how to flip the fear on its head. So I have a thing I used to do a lot when I was first diagnosed and was getting out there. I would hold a coin in my hand, like a quarter, and I would just say, okay, if you're afraid, flip the coin into fearlessness. Just having the coin in my hand and flipping it around would shift my energy. And so it's just learning how to navigate the journey. And my daughter, she's 18 now, but we talk about everything, about fear, when I'm fearless, when I'm strong. And so it really is about having a lifestyle plan to navigate dealing with fear of recurrence and also learning how to badass your way through life, because cancer happened in your life. It doesn't become you. And you're not just a cancer survivor, you're a person beyond that journey as well.
One thing you said is really important, and that's talking about your fears and concerns. So discussing these fears, with your family and friends, is just so important. And generally, friends and family, they're very supportive during your treatment, but they may not even be aware that you're still having ongoing fears and concerns after your treatment is completed. And just make sure, I think talking to other survivors who have gone through the same things that you're experiencing, I think that is awesome. It really is helpful. There are various online and in-person support groups where you can express your fears and concerns to people who have gone through this same process. I always tell patients, if you're having difficulty locating a support group, your nurse or social worker, they can help you to identify some resources. And not only can these individuals support you, but you will also have an opportunity to share, your own experiences and help others. We just need to make sure that patients are communicating or talking to the physician and nurses about their fears, because they don't know. You just have to make them aware. They have an idea, because that's typical. You see this with patients who have completed therapy, and you see that fear of recurrence. And then the other thing I think that's a good idea, you should consider counseling, from a psychologist or a social worker or even a psychiatrist, because these professionals can, help you to develop coping strategies to help you to alleviate, your fears and anxieties, and to help you just to move forward in your life. You also need to keep in mind that it may even become necessary or useful to be prescribed anti-anxiety medications should your fear and anxiety become unmanageable. And then I think the final thing is, you just need to be patient with yourself. That's just important. For most people, the fear and anxiety will, get better over time. I always like to tell people that it may not go away completely, but over time, it may become more tolerable and occur less frequently.
You just spoke a whole sermon. That was incredible. Thank you for that, first of all. I want to acknowledge you and the depth of your thinking, because it's so important what you do as a clinical nurse educator. You mentioned family, first of all, and educating them about your journey, because people are there when you're going through cancer. And over time, as even though you're tired, they're worried about you, and they may not be thinking about your fear of recurrence after cancer treatment's over. And so really talking about that is so important with your family, explaining what your needs are post-cancer, that you still have this fear, you still have to deal with fatigue and other issues about recurrence. And I have 4 brothers, and of the 4, 2 were more involved, and 1 didn't want to talk about it at all. He just couldn't talk about it, and I was so hurt. And the other 1 would come by and he would leave. And once treatment was over, they kind of went back to their lives, right? But I was exhausted. And so I spent some time being a little bit angry at the 2, because they didn't understand I needed support. I thought that, what if I had died, would you not have cared? And not till years later, we had a little argument, and he said to me, I was too afraid to lose you. That's why I pulled away, And so we had to work through that, because even though I was afraid of having a recurrence, he was afraid of losing me. And so he had to be taught how to support me, after cancer, and we're now a lot closer. We actually had a family group counseling session where we talked about it, but they had to grow as well as I did, right? Cancer impacts the entire family, not just the person that's in treatment. We talked about also, getting therapy. A lot of people are, not comfortable getting therapy. They feel like it's something they need to just, they have to push through the cancer and push through the fears. But therapy, you're right, it's really, really important. And just being patient with yourself as you navigate the journey of living after cancer or living with cancer. I began seeing a therapist after my treatment was over, and then I thought, I'm good, I don't need this anymore. Probably 2 years ago, I began to lose friends back to back to back to back. And it was one trigger after the other. And then one day I was like, I need help, and began seeing a therapist. And I realized that I had just pushed my fear down. And so even if you are a warrior or you're strong, I think that also is a strength in vulnerability and saying, I need support. And to your point, I feel more alive now because I'm dealing with my fears and I'm doing my work. I don't have to separate the two. It's all part of my strength. So for those who are watching again, vulnerability is your power. Asking for help, sharing your feelings, being vulnerable, and just loving yourself, giving yourself grace is so beautiful. The way I see myself now is different than I saw myself 2 months ago or 2 years ago. And so for those patients watching who just heard the word to have breast cancer, whether you're midway through, whether you're early stage metastatic patient, you're not alone. You are loved. There is support out there for you at Tiger Lily and other organizations. Just hold on, and we are here to get you through this. And we're going to love you and have a heart space we're going to reserve for you to get through this journey. I want to ask you more about the fear and how it can hinder a patient's ability to get through treatment, and telling their provider what they need. We don't want to call doctors too much to ask for help or call the nurse too much off hours. But how can patients be more comfortable talking to their providers? And then conversely, how can the providers be more proactive with giving their patients what they need?
The number one thing that I tell patients is to make sure that you write things down. Keep a little notebook or what have you. But, patients are maybe so fearful that they can't remember what the HCP communicates during the visit. And so, therefore, allowing them to email questions in advance of the visit through like the EMR, the electronic medical record, maybe bringing in a scribe, because I have an uncle that's undergoing cancer therapy right now. He's in Las Vegas. And when he meets with his physician, we Zoom in and we ask the questions. My sister and I are both nurses. This ensures that there are objective listeners present, because it would go over my head too. I've been through a cancer scare. I'm a nurse and I didn't remember anything. I was just completely in a fog. The fear of that potential, diagnosis and the biopsy and just waiting and waiting, for the results, that was overwhelming for me. When I worked at MD Anderson, we provided patients with an anxiety scale. There are various scales out there that can measure one's anxiety. And I think the other thing is just providing patients with a list of key questions to cover on every visit, and also encouraging the patient and letting them know that there are no stupid or silly questions. Every question is valid. Because a lot of people don't communicate clearly, or they may not understand all of the jargon, the medical jargon. Just let them know. Just ask the question. We're human too, and we'll understand what you're saying. Just, if you want to write it down, write it down. But don't worry if you don't have time to do that. Just say what's on your mind. Just be honest about it. There are many resources. There's a website called Recurrence.com, and it contains a breast cancer discussion guide. And this guide focuses on reducing one's risk of recurrence by starting with asking your healthcare provider important questions about recurrence. By having these discussions, the healthcare provider can actually help the patient to feel more confident that they're doing everything they possibly can to reduce their risk of recurrence. That guide, also contains awesome tips for facilitating discussions, with nurses, doctors or whatever. I think that is just an awesome tool. And then you have Tiger Lily. I do a lot of work with Sisters Network. They have information, they have seminars. And then, the other one that I like is breastcancer.org. I think that's a great tool to educate women about breast cancer, and it is just a great site. So there are resources out there.
And then there's you, who is a plethora of information as well. People of color face multiple barriers to care, to access. I'm sure you know all the issues around health disparities and lack of equity. How can Black and Brown patients be less afraid to address concerns with their healthcare provider and their healthcare team in general?
It's interesting because when I did my dissertation, I kind of looked at that area, and often a key concern amongst patients of color is that fear of mortality and faith cannot coexist. And people of color, we're very heavily tied to our church. Providing patients with, accurate or good information on their diagnosis, their prognosis, and a treatment plan, along with support from members of their faith community, can help to dispel some of those fears. I attend a church here in Houston, and they have a survivorship program. They have a support group for people with cancer. They have a psychologist and a psychiatrist, because most of the people who attend my church, it's a huge church in Houston, they actually are homeless. And so they have these resources available on a daily basis. COVID has changed things a little bit, but they do have those resources for patients. People of color, one of the common misperceptions is that they did something wrong to cause their cancer. I think that's something that we really need to address, and a healthcare provider can, bring the patient into the present situation and actually help them to create a plan to move forward. I think those are, when dealing with people of color and educating them, I think these are things that we have to keep in the back of our minds, because my family, I remember when my aunt, she had breast cancer. Everyone in my family except my sister, all of the girls are nurses, and all of my cousins were all nurses, the females, and everybody whispered cancer. They never would say it, in a normal tone. It was like whisper.
I have cancer. It's okay. I mean, it's not okay, but I will deal with this. But calling it a C word, whispering about it, is not how to help people that are going through the journey. But also, while I'm thinking about this, you mentioned something really huge about family, generational, literacy around health. The lack of talking about cancer in our families, even health issues. I remember, seeing people in my family that I loved go through something, but they were kind of like kept in a room or a corner of the house. You couldn't go in that space. There's this whole shroud of secrecy around it, and it made it kind of dark for me as a child. I would have nightmares, and they would die, and nobody would explain to me why that uncle was gone. There was no talk about what happened to them, and not till I got diagnosed myself did I truly understand the importance of generational conversation about family health history. I'd love for you to share with our viewers how important it is to know your family's health history, because it can benefit you in terms of being proactive, being your best advocate, and maybe even help to prevent or lower the risk of cancer and help you to journey through that without feeling so lonely. Can you share a bit about your experience about families and how we do or don't talk about health history?
I think understanding how your family copes with illness in general, and especially in terms of, cancer, I think it can help you to choose a healthy path to addressing fear. For example, if a family member with a serious illness ignores the condition, or they don't seek care in a timely fashion, or maybe they may have had poor outcomes because of fear of the unknown, especially with people of color. And we know that early screening and detection leads to better outcomes. Now, in terms of knowing your family's history, that is key. One of the things that I recommend to people, not only write down their family history, find that out, ask those questions, but I also tell them to make sure you know your history, make sure you have your health history, because the first thing you do when you go to the doctor's office, they ask you to fill out all these forms with all your illnesses and all your medications. And so what I do for myself and for my mother, I have it in my phone because it's always with me. And so I tend to keep that information on me, or I'll print it out so that I don't have to write it out when I get to the doctor's office. I just like, here you go. But I think just knowing your family history can help. Sisters Network is getting ready to start a new project where they are utilizing teenagers, young girls, 14, educating them about the importance of examining your breast because they aren't eligible for mammograms, and then the importance of receiving mammograms. And with that program, they have a list of questions that these young ladies go back and ask their family members. And they encourage them to go in, get your mammogram. Why haven't you had a mammogram? Did you know that the earlier breast cancer is detected, your outcome is better? We know that African Americans have a tendency to be fatalistic in terms of a cancer diagnosis or period. And there is a tool that measures that. I used that in my research. It was called the Cancer Fatalism Tool by Barbara Poe. And it measures your degree of fatalism. Fatalism is defined as, if I have cancer, I'm going to die. It doesn't matter what I do, I'm going to die. Yeah, we're all going to die, but you might not necessarily die from the cancer, and getting them to understand that is key, getting family members. And I think it's a wonderful thing to use young people, they're learning, and then they're passing what they're learning to their family members and neighbors.
Yeah, my mom taught me breast exams at 13 years old. And I always tell people my mom gave me life and saved my life. Because if she hadn't talked to me about breast examinations at 13, I would not know to do my exams every month. When I found a tumor at 31, I wouldn't know to even ask for a mammogram. I wouldn't have had a doctor that I trusted to go to and say, can I get a mammogram? Can you check this out? But the surgeon then told me I couldn't have cancer. I was too young. But I had a mother who educated me at a young age, made it a part of my lifestyle to the point where I would do it every day in the shower. I would be like taking a shower, singing, and doing my breast exams. I'm a firm believer of getting women educated early. That's why we even began Tiger Lily. Like, our whole premise is educating girls as young as 13 years old. We have a program called Petals, where we have girls who we reach out to, who we train. We have a cohort starting in about 2 weeks, all around breast health, breast cancer, self-advocacy. And we have a separate program for our angel advocates who are older. So we have one for those who are teens and one for those who are older, not just to be educated, but how to work to end barriers for themselves in the healthcare system. So when you come against a barrier, like a doctor who dismisses you, fire the doctor, get somebody who you trust. If you can't get to treatment because you don't have a car, you have a resource for people the entire way to get through treatment with all the support and help that you need. Again, this is how you create self-advocates. You start them young. You teach them the tools they need to educate themselves about breast cancer. So you talk about it often. You make it part of their lifestyle. You give them a whole toolkit so they can know how to navigate if and when they get breast cancer or a friend gets the diagnosis. If you understand the disease and what can happen, you're going to be proactive about it. You're going to ask your parents, well, what did my cousin, auntie, so-and-so died from? And so I feel like it's really incumbent to have these conversations with our family members early and often because it can save a life. I just love this conversation. You're such a wealth of information to talk. Just talking to you is like getting a whole lesson in empowerment and advocacy, and it's really inspirational as well. I can tell you're a very heart-based person and you love what you do. And people need physicians like yourself who are patient-facing and who are patient advocates and who really care and lean into us as we're getting through this whole journey of learning a new way to live, a new normal, and really discovering ourselves again, through and after breast cancer. What are resources you recommend a patient seek while navigating the emotions around fear of recurrence?
I think I mentioned a couple of them before. Breastcancer.org is a wonderful site. It's reliable. I think having reliable resources that are valid, because there's a lot of stuff on the internet, and and not all of it is good stuff, good information. And I think it's just important for patients that they have access to these resources. And not everybody has access to the internet. ReduceRecurrence.com is a good site. And then, organizations like Tiger Lily, wonderful resources. The American Cancer Society has been around for a long time, and they have lots of resources as well. And then, like I said, the Sisters Network. And then, I know most larger academic facilities and some of the community practices, they have like a library for patients. I mean, Anderson has a huge library where you can check things out, and a lot of the materials you can keep. Very, very informative and great information. I think one of the things that I think is most important is, just like I said, have it at a reading level where everybody can understand it. Simplicity is key. I'm a nurse and I try to keep things simple. No matter what. It doesn't matter who I'm talking to. I can remember telling patients, if there's something that you find on the internet, kind of check with me so we can make sure that the information you're receiving is factual and, credible. I think that's something that healthcare providers need to, say over and over to their patients, because you know what? Some of the stuff you read will create all types of anxiety.
I tell all my patients that come to us, I say, don't go on the internet, but of course you do, because you want to read what Dr. Google is going to say to you. But it's terrifying. You read horrible things. People will say things to you like, oh, you have breast cancer. My cousin had it too and she died. I'm like, you know what? I don't want to hear that. So it's really important. I tell people to guard yourself, guard your mind, guard your space, guard what you're reading, watching, and who's in your space as well, right? Because you want to protect yourself to be able to lower your stress throughout the journey of dealing with cancer. But there are some things that come out of it that are positive when you face your fears head on. I always talk about, like, for me, when I got diagnosed, I was scared out of my mind. I could not think straight. And then I threw a party in a month and said, everybody come to the party, let's have fun. And I was in denial. They were like, you're in denial, which I was. My thing was, I'm still alive, right? I'm still here. But then I realized, like you said, we're all gonna at some point leave this earth. So whether it's gonna be in 3 months, 6 months, 9 months, 25, 30 years, I could live my life on my own terms. I could create life that I loved. For me, the positive outcome was that I became a person I didn't know existed. I didn't know I could be this kind of person. I was very timid, very shy, not outspoken, not sure of myself. But then I thought, this is not who I really am. I'm more than this. And I began making a list of the things that scared me and doing all those things, and I grew so much. I just would encourage all the patients watching to think about where you are now in your life and how can you utilize what's happening in your life to kind of crack open the idea that you could be this person that you can't even imagine right now. And you'll become that person. So let the journey be a catalyst for you to really expand your life and grow and change and metamorphose, because it can be that for you as well, as it was for me. Dr. Pat, what are some things you've seen from your patients when you work with them as a nurse, educator, as a researcher, physician, in whatever capacity, that have been positive outcomes from really engaging their fear head on?
I think that patients who tend to have, some of the best physical and emotional outcomes are, those patients that surround themselves with a safe circle of support, where they can feel free in expressing what they're feeling without fear or judgment. I think that is so important. So I think that those patients have the best outcomes. Once you get over that barrier, of not whispering the word cancer, once you kind of get past that, and everything builds on itself and things get a little bit easier. But patients need to know that it's okay to talk about it, and just have that safe environment in which they can do so and express their feelings.
Yeah, as you're talking and I'm feeling your energy, I feel like what you emanate for me, it's like a mirror, because I feel like the great equalizer in all of this is love. It's having people around you that give you so much love that it can drown the fear away. It's giving yourself so much love that you put yourself in a safe space, that you take care of yourself. Things before that I would do is like rush through my shower, and I would get out of bed and I would just put on music and run in the shower and dance and whatever, and get my daughter ready for school, and then I'd go to school. But there are days during treatment when I couldn't even get out of bed. There are days when I couldn't even go to the bathroom by myself. And so when I finished treatment, I remember one day I got out of bed after 3 weeks had passed, and I put my feet on the ground, and I got up and I was like, oh, I can just get up. Like, wow, I just did that, And I just got up and walked. There was no pain. I didn't feel nauseated. I didn't have a headache. I was like, oh my God. And then I said, I'm gonna go for a walk later on. And I went for a walk, and I was walking, and I walked about a mile, and I felt great. And over time, my body got stronger and stronger, because I'm a runner, so I stopped running. I just didn't have the energy for that. And then one day I went for a run after 3 or 4 months, and I was running, and my heart was pounding, and I was sweating. The sun was on my face, and I felt like God was talking to me. And I'm like, this body has got me through so much. And I took it for granted for a long time. I would just get out of bed and assume that when I thought to move my hands, they would move. My eyes would just work. I would smell and taste, and my body would just do all these things. But the fact is that, God makes it so that our bodies, they do all these things for us without us knowing. And so it's just so important to appreciate the little wins. And what I began to do in treatment is like, you know what? I got through this moment. If all I did was breathe in this moment, that is enough. If I could just breathe, that's enough. The next moment, just breathing is enough. The next thing you got through 1 minute, 5 minutes, 20 minutes. And so even now in my life, at my work, my meditation practice is all about breathing. That's why I wanted this to be called Breathe, because there's so much pressure on ourselves and our families when we're going through cancer. And so if you just breathe right now, that's all you can do. And it's a lot your body's doing so that you can breathe. It's enough.
You're right. Absolutely. That's so beautiful. That is so beautiful.
We put ourselves through a lot, but our bodies work a lot for us, and a lot works on our behalf. So just love for those who are around you, who give you love for yourself, having that sacred space of protection. You mentioned family and friends just protecting you and guarding you, and just breathe. All you can do is be in the moment, and the rest will handle the next moment. And that's, for me, that's been one of the biggest ways to eliminate or to lower my fear. It's just to know that, okay, I'm here and I'm okay right now. And
That's
then,
right.
oh, a minute just passed. I'm here and I'm here right now. Just to breathe, and that's enough.
Yes, just breathe. That's true. That's so beautiful and so very true.
I feel like I could talk to you for another hour and just like look at your beautiful face and just learn from you and feel your energy. And I know that those who are watching this are going to get so much out of the episode, hearing your story. But as we're closing the episode out, what would you leave the guests with? If you could say one word that would empower our listeners and viewers to feel, to emanate, and to take with them.
Just like you said, breathe. I think that is so beautiful. And just, understand that there are resources here to help you to get through this. And if you don't know what to say, there are resources out there that can help you to determine what you need to talk to the physician about. Don't sit. Surround yourself with people who love you and friends and just other people in general. And, they'll support you. If you let them know, what's going on, they don't read minds, but let them know what you're in need of. And it's so true because what you said earlier about when you first are diagnosed, you have these people, they're all around. And then when you get the final report and they said, oh, you cured, but then people don't realize that it may come back, so they don't read minds, like I said. So you do have to kind of let them know what's going on and don't be afraid. Figure out what those triggers are that cause you to be anxious or fearful. And then, rely on some of those things. Some of the things that you might have used in the past that aren't even related to a cancer diagnosis. How you handle stress. I can think about things I still do today. When I was in nursing school, it was incredibly hard. And so I still fall back on those basic principles. And usually it's centered around prayer. And I can do all things through Christ who strengthens me. Almost every day, even before we started this presentation, I was like, okay, I was nervous and I said, okay, I can do all things. Not something, all things. And so I just think people should fall back on that. The same things you mentioned, yoga, meditation, scripture, exercise, nutrition, it just makes you feel like you have control over things. Just take back some of that control and try to not let fear just overtake or overpower you.
You're amazing, Pat. Thanks for being with us today on Breathe TV. You're so inspiring. You're so amazing in so many ways. And I just thank you for gifting our viewers the gift of your presence, your education, your time, and your heart. And for those who are watching Breathe TV in this moment, I would ask you to take a moment just to breathe and know you're not alone. And you're in a space with us that's sacred and safe. We love you very much. Thank you all. Until next time.
Brought to you in partnership with Puma Biotechnology.